My name is Bryce Vanderay, and I'm the Journey Kids Director over at the Journey Hanley Road. Thank you for being with us today. We're going to be jumping into health and wellness. So, without further ado, we'll go on in. So, first thing on the list is snacks and food allergies. Basically, our biggest rule is that we really don't allow outside snacks and drinks because of all the allergies that kids may have, and we have a lot of visitors all the time. We don't exactly know what their allergies necessarily are. We don't have peanuts, we don't have milk, we don't have, all that type of stuff. Now, there are some exceptions, and the exceptions are water cups that kids bring from home, formula or breast milk, and then any snack that is pre-approved by Journey Kids director. So just be aware of all of that. And in the medical notes, when kids sign in, they put in their, at least we want them to put in their allergies in the medical notes, and that will pop up on their tag. So be aware of that with your kids. Next, we're going to talk about sickness. Basically, if a kid is exhibiting any of the following things, they are not to be permitted in Journey Kids. Okay, so if they're dealing with any of these things at the moment, they're not going to be allowed in Journey Kids. Now, there's also a few rules that are based on 24 hours. So, number one is that, let's say a kid is sick or has a virus of some sort and they're on an antibiotic. We require that they have been on that antibiotic for 24 hours before coming into Journey Kids. That way, that 24 hours ensures that they're not contagious anymore. Same with a fever. They've had to be over their fever, not just in the last few hours, but in the last 24 hours. And then same with any of these symptoms that you see above. We just want to make sure that they've not only well at this moment, but they've been well for a day before coming into Journey Kids. And then, of course, we have lice, right? Now, if you do come across a kid that has lice, please immediately contact the Journey Kids staff, and that is it. Okay? Do not make a fuss with parents yet or like anything like that. We don't want to spread panic, right? Because a lot of times that is what is included with lice is a bit of panic. Because of how hard it is to get rid of and what a hassle it is. So we just want to tell the Journey Kids director, and they'll be able to both take care of that kid, but also communicate with the parents we need to communicate with and everything like that. First aid and medication. We have first aid kits in all of our rooms. They have all the basic things, so please use those if it's minor. If it's something that is, you don't have it in the kit or it needs something more, it's probably severe enough that we can tell the Journey Kids director and they can help you. There's also ice packs available as well, but you just need to ask, and then one will be brought to you. And then for medication, we never administrate medication. So if a parent asks you, hey, halfway through Journey Kids, please give them, this, whatever. No, we don't do that. The parent is going to have to come down and do that, if they need something like that. And then lastly, EpiPens. If a parent says, hey, he has an EpiPen, please tell a Journey Kids staff member so that they can be aware of that. And also, like, if the parent asks you, hey, there's an EpiPen and you will be the one who has to administrate it, please bring that to the Journey Kids director, and maybe they'll be able to have the EpiPen, or we'll figure that out, because we do want you to have some sort of training before being responsible for that. So EpiPen, bring that to the Journey Kids director. And then sanitizing toys. We just want to be diligent with this because this is one of the main ways that germs is spread in Journey Kids, is through toys that have been put in somebody's mouth and then transferred to another kid to have the same done with them. So we just want to be diligent during the service to set aside toys that have been, in the mouths of a kid, and so that they can be cleaned before putting back in for other kids to play with. And then, of course, after all the kids are gone, cleaning the toys after the Journey Kids service so that they're ready to go for the next service. We just want to have a really sanitized environment for kids to play in. And then bodily fluids. We just want to have extreme precaution when we deal with blood, vomit, any other bodily fluid. We just want to use gloves. Make sure we're not getting it on our skin and disposing those in a lined trash can, and then of course finishing that up with thoroughly washing our hands and arms and whatever else might have touched or gotten close to that. If you don't have time, or whatever, it's like a bang bang situation. You don't have time to get it. Try to have something between your hand, whether it's a towel or whatever. But if you do end up touching it on accident or whatever, we just want to thoroughly wash our hands so we're not exposing anybody to anything harmful. And then with hand washing and sanitizing, this is in some ways kind of a catch-all that we just want to keep ourselves as clean as possible so that we're not participating in the spreading of germs and sickness. So we wash our hands before getting into Journey Kids, and we sanitize often, especially when we are helping kids, get their snotty nose or changing a diaper, helping a kid in the bathroom. All of those instances, we want to make sure that we're at least sanitizing our hands with, the sanitation gel or washing our hands, preferably. So just be aware of that when we're in Journey Kids.